friends, I'm Adriana from Faculty of Medicine, University of Malaya, Kuala Lumpur. Today, I would like to talk about matchmaking in physiology. Our lungs are really the essential interface between the external world and the world of physiology in our body. Here, the pulmonary ventilation means pulmonary blood flow. In respiratory language, we talk about ventilation-perfusion matching or balance. An index of this relationship is then the VQ ratio. When the whole lungs are considered, in a 70 kilograms male adult, the alveolar ventilation is about 4 liters per minute, and the pulmonary blood flow, which is the right ventricular cardiac output, is about 5 liters per minute. The overall lung VQ ratio is then 0.8. However, the lungs are quite large, and when a person is standing, gravity has an effect on both the pulmonary ventilation and pulmonary perfusion. From the base to the apex of the upright lung, both the alveolar ventilation and pulmonary perfusion decrease progressively. Just remember, things are not always better at the top. Gravity affects hydrostatic pressure, and the effect on pulmonary blood flow in the upright lungs is due to the effect of decreasing hydrostatic pressure from the base to the apex. To account for the effect of gravity on the alveolar ventilation, note that the negative intrapleural pressure is less negative at the base of the upright lungs. The transpulmonary pressure is then less at the basal alveoli as compared to the apical alveoli. At the end of the normal expiration, which is at functional residual capacity, the distending transpulmonary pressure will be less at the basal alveoli. Hence, the apical alveoli will be larger than the basal alveoli at functional residual capacity. When a person takes the next breath, more of the tidal volume actually ventilates the smaller basal alveoli. The larger apical alveoli are actually less compliant than the smaller basal alveoli. Thus, alveolar ventilation is better at the base of the upright lungs. The decrease of pulmonary blood flow from the base to the apex of the upright lungs is steeper than the decrease of alveolar ventilation. Thus, the VQ ratio is highest at 3.0 at the apex and decreases to less than 0.8 at the base of the upright lungs. Ventilation-perfusion matchmaking in our lungs is essential for optimal oxygen and carbon dioxide exchange, so we can all live happily ever after. And that is all for today. Thank you.